Welcome to Nurse Pro. The purpose of this channel is to help you to pass your OSCE exam, to get a license and to work in the UK. So today our topic is oxygen therapy. So this is just for sharing, and it is recommended that you use your own words and arrange your own sequence to do the task. And also, please check the latest marking scheme. Don't miss the latest points because the NMC will update the marking scheme every few months. So for general steps for all stations, please refer to the video of OSCE Framework. It will give a detailed framework and the flow of how to perform the procedural skill stations. So for those general steps, I'll go over it very quickly. So number one, before you approach your patients, you need to ensure that the environment is clean and safe, the floor is clutter-free, and then you need to maintain privacy and dignity by closing the door or closing the curtain. And also you need to do the hand hygiene. And then number two, you approach your patients. You say hi to your patients, you do self-introduction, and also you need to ask your patients, how would you like to be called? How shall I address you? Then use a short sentence to state the aim. Let the patient understand why you're coming. And then you need to check the identity. This is very important because you need to make sure that you got the right patient. If you're in the hospital, please check the full name, date of birth, and hospital number. If you're in the community, please check the full name, dates of birth, and the full address. And then you need to check allergy, and you need to restate the aim, give more information to your patient, and also you need to gain consent. That are you happy for me to proceed now? Something like that, yeah. And then you also need to check the comfort, the positioning of your patient. So you need to make sure that your patient is physically and psychologically ready for the procedure. And then you leave your patient to prepare for your task. So in this video, the main focus is oxygen therapy. You need to be ready that your patients may be having severe shortness of breath. So maybe the first thing you need to do is top up your patient. This is very important for your skill station. But let's think about it. Why patients need oxygen therapy? Likely it is the reservoir mask. We need to give it 10 liter or even 15 liter of oxygen therapy to your patients. So the main reason is that your patient is having severe shortness of breath. Maybe his or her oxygen saturation is below the expected value. Alright, but oxygen is a medication. You need to check the prescription before you give it, because this is an exam, right? But at least you can pop up your patient. You can position your patients better. When you pop up your patient's lungs expand better, so breathe more easily. So make sure that pop up your patient. Let the patient to sit upright. You may need to do this as soon as possible. You may need to do this before you check the identity. If the patients cannot speak a word, you cannot check the identity. So therefore, you need to be prepared that you need to first pop up your patient, and then when your patients feel better, you ask further questions. Alright? So in this station, you got 10 minutes. And again, positioning is very important. Make sure you pop up your patient. Then you need to explain the reason for the oxygen therapy. It may due to patient's low oxygen saturation or the shortness of breath. Then the doctor prescribed the oxygen to your patient via the oxygen mask, maybe the reservoir mask. And then the purpose is to improve the overall oxygen saturation. And also, you must reassure your patients that you will monitor their oxygen saturation as well as the respiration. Again, pop-up is important. So when the patients said yes to your oxygen therapy, you read aloud the whole prescription. 5 write patient, write drug. This time the drug is oxygen. And then write dose. The dose is the flow rate. And then write date, time, and frequency. For right routes, see which device the doctor is prescribed. Make sure you check allergy for every medication. and you need to ensure the prescription is complete, valid, and eligible. So this is the oxygen reservoir mask. So when you get ready, you return to your patient. You may need to do it quick because your patient is having low saturation. It's having low oxygen saturation, okay? So make sure you do your hand hygiene. And then when you back to patients, gain consent to proceed and check identity, just use a few seconds to do it very quickly. And then you prepare the oxygen mask. First of all, you need to attach the tubing to the flow meter. And then you adjust the flow meter to the correct flow rate according to doctor prescription. Then you need to cover the one-way valve with your fingers. You need to show your examiner you are doing these things until the reservoir bed is fully inflated. Alright? So do not use an empty reservoir bed and apply it to your patient. You need to make sure that it is fully inflated. Then is the mask application. Apply the mask over nose and mouth, and then you need to check the mask position. You need to check the elastic straps all over the head circumference, and then you need to check the nose braids, and also you need to check the straps on both sides, patient's faces, both cheeks. Okay, you need to make sure that the mask is secured but not too tight. After the application, make sure the patient is comfortable. The straps are not too tight for the patient, because if it's too tight, it will induce pressure shock. If you are finished, document. Complete your medication record. Sign with your initial, write the date and time, and you may also need to write the types of masks that you applied and the flow rate. It should be exactly the same with doctor prescription. If there is a table asking you to write the administrator name, please make sure you write it. Next, there are a few areas that you need to focus on. Number one is the oxygen saturation. You need to tell your patients that you will monitor patient's oxygen saturation. The target range should be written down on your question paper, but normally it should be 94 to 98%. And then number two, you need to monitor the dryness, because patient is using a high flow oxygen. So those dryness will be seen on mouth, lips, and face. So further nursing interventions are needed. For example, apply the oral moisturizer to the oral mucosa, apply lip balms to lips, and apply face moisturizer to face. So these are the nursing interventions correspond to the dryness associated with the high flow oxygen. And then point number three is the skin inspection. You need to inspect patient's skin regularly. You need to detect if there is any ulcer appeared. So mainly on patient's face, ears, and back of head. So you need to tell all these points. When you're finished, please document as soon as possible. Sign your initial, date, and time of administration. So before you end, make sure the patient is comfortable, oxygen saturation is okay, it's normal, it's within the target range. Actually, patients requires close monitoring because patients is having high flow oxygen. And then also, make sure you give a call bell to your patient and ask your patients to press the call bell if he needs any help or if he experiences shortness of breath. And then do proper waste disposal with hand hygiene. And also you need to clean equipment, any equipment you have used. So again, to cope, we need to fulfill it, prioritize people, practice effectively, preserve safety, promote professionalism and trust. So this is the end of the sharing of the oxygen therapy section. Remember, you need to understand the whole procedure. You need to remember that your patient is having severe shortness of breath. So the patient requires high flow oxygen. Close monitoring is compulsory. So you need to monitor patients, oxygen saturation, respiration, also the dryness associated with the high flow oxygen, and also the skin inspection. You don't want any pressure sore. You also need to show your examiner that you will connect the tubing to the flow meter. The flow rates should be exactly the same with doctor prescription. And you also need to demonstrate the technique that you use your fingers to cover the one-way valve until the bed is fully inflated before the application. Alright? Hope you find this video is useful and hope you complete the task easily and successfully. If you like these videos, please press like and subscribe to our channel. See you in the next video. Bye!